Asthma and homeopathy. First, let us find out what is the definition of asthma. Bronchial asthma is a chronic inflammatory disease of the airways that is characterized by increased responsiveness of the tracheobronchial tree to multiple stimuli, followed by rise in IgE antibodies when they come in contact with the allergens. It is manifested physiologically by a widespread narrowing of air passages, which may be relieved spontaneously or a result of therapy, and clinically by paroxysms of dyspnea, cough, and wheezing. There are various causes of asthma like pollens, molds, house dust mites, air pollution, pet dander, tobacco smoke, chemical irritants, any stressful event like death, financial loss, failure, bad news, trauma, etc. In asthma, what happens is there is a decrease in the lumen of the airways, resulting in twofold response to the allergens and other irritants. Primarily, there is a hyperreactive response. The smooth muscles in the airways constrict and narrow excessively, and followed by the inflammatory response. The immune system responds to allergens by sending white blood cells and other immune factors to the airways. These inflammatory factors cause swelling of airways and also an increase in mucus secretion, thus causing symptoms like wheezing, cough, and shortness of breath. There are different types of asthmas like atopic or allergic or extrinsic asthma, non-atopic or intrinsic asthma, cold-induced, exercise-induced, occupational and stress-induced asthma. If we look at the homeopathic approach, first we'll have to deal with the miasmatic cleavage of asthma. Usually we think that asthma is only psychotic in nature, but that is a myth because asthma can present to us in all the three miasms. There could be soric asthma where the soric personality is typical personality of positive approach, constructive, natural swing and changeability of moods. Disturbances are functional, so you will hardly see any secretions in this phase. So even if the person in asthma is coughing, it will be a dry cough. There won't be any productive sputum. Predominantly there will be spasms with no secretions or minimal secretions. But most important is there is an active skin complaint or history of skin complaints. Asthma in soric phase is purely of psychological origin. It is beautifully represented by remedies of the hysterical group like pulsatilla, ignatia, nux vomica, asafoetida, etc. In psoric asthma, the symptoms appear and disappear suddenly. With your medicine, if you are able to re-establish skin symptoms, the patients feel better immediately and spasms go away and do not recur. Breath holding spasms in children come in psoric category. The changes are functional and they are easily reversible. Once you give the right homeopathic medicine, one can easily produce a cure. In psychotic asthma, as everybody knows, psychotic personality is one of sluggishness, slowness, fixity, jealousy, revengefulness, tendency, etc. The most important is aggravated by damp constitution. This is known as the hydrogenoid constitution. So these people who are suffering from psychotic type of asthma are aggravated by damp weather or getting wet in the, but they are better in dry climate. And there is a marked cough with little expectoration which comes out with great difficulty. There is history of suppression of discharges from mucous membrane, but these are the pathological discharges. In physiological discharges, it was the psoric asthma. In pathological discharges like cold, sinusitis, cough, when the discharges are suppressed, the disease progresses much deeper and creates complication. Typical psychotic discharge is yellow or yellowish green, thick sticky discharge, which is very difficult to expectorate. As soon as we establish the abnormal discharge, the asthma is better. And the most important thing is psychotic asthma is associated with musculoskeletal affections like lumbago, rheumatism or any joint complaints. What is tubercular asthma? Now tubercular personality everybody knows is characterized by erraticity, marked anxiety with imagination, building castles in air, erraticism at all mental levels as well as the physical levels. Recurrent infections. Patients usually have a narrow chest and are weak and easily exhausted. Tubercular asthma, there is a history of viral infection leading to or complicating asthma. Patient might have post-history of measles, mumps, chickenpox, etc. Attacks are erratic and the severity may decrease or increase rapidly. There could be a family history or past history of tuberculosis which makes the individual susceptible to various kinds of infection. Here, it is different from psychotic and psoric asthma that a cough is with excessive expectoration, which is purulent or mucopurulent in nature, and expectoration comes out very easily. So now all of you know that psoric asthma, psychotic asthma, tubercular asthma, we can differentiate by the patient and the symptoms of the patient, whether he is expectorating, not expectorating, whether there is a suppression of discharges, whether there is a family history. In tubercular asthma, you also see easy suppuration with tendency to superadded infection and fever. There are fibrotic changes, the vital capacity of the lungs is decreasing over the period of time, and the person feels breathless, even in normal circumstances. Out of all the different conditions, tubercular asthma is the most difficult one to manage because it responds in a very erratic way to environmental circumstances and also to treatment. The patient may be improving, but suddenly he'll go into severe spasm and complications start and responds to treatment but feels better after some time. Last but not least, let us not forget our most important miasm, and that is syphilitic miasm, the syphilitic asthma. You know, syphilitic miasm is characterized by structural changes. There are nothing functional, there are no PQRS, there are no characteristic symptoms, and there are actual structural changes in the lungs. What is the structural changes? Like emphysema. Structural changes like emphysema and syphilitic asthma are more marked. Continuous breathlessness, emphysematous changes are extensive. Patient feels breathless even on slight exertion or even at rest. Auscultation shows some rhonchi here and there even when there is no attack of asthma. Because of breathlessness, availability of pure air is less. The heart is put to stress and therefore the heart has to supply excess oxygen. So it has to work more harder and the patient suffers from cor pulmonale. Now let us look at the manageability and curability of bronchial asthma. Most of the allopathic physicians, when anybody goes to take treatment from them, they'll say that bronchial asthma is something which cannot be cured, can be controlled but cannot be cured. But we can't say that in homeopathy because we know that bronchial asthma can be cured with proper homeopathy. What are the chances of cure? The chances of cure increase with all these conditions. Younger the age. Now remember, if the patient is young, he is a small kid and is getting asthma, there are chances of cure are much better in this child rather than an adult. So it is very easy to manage if the patient is young and has got a good vitality. Shorter duration. If the person is suffering for asthma for a very short duration, there are more or less functional changes and less structural changes. It is easy to manage and cure. Third most important thing is no suppressive line of treatment is taken. If the patient has taken minimum medicines, then it is very easy to manage. But if he has taken many medicines, especially steroid puffs, then it is difficult to cure him. Less chances if it is old age. Older the age, difficult to manage. Longer the duration, difficult to manage. If suppressive treatment is taken, less chances of cure. And third and the most important thing is the anxious patients. Patients who are anxious about their disease condition, most of them are dependent on steroids. As soon as the effect of the medicine wears off, they get spasms again and develop an attack of bronchial asthma, or the residual disease condition always remains, irrespective of the treatment taken. Now, if you look at the miasmatic stage, in soric stage, as the changes are more functional, you have to give the right simillimum in higher potency and minimum repetition. By functional changes, I mean that in this type of asthma, the patient is going to come to you with a lot of characteristic symptoms. Imagine a remedy called Ipecac, where the patient is going to say his asthma is also associated with nausea. Nausea, which is not better by vomiting. The nausea is so much. There is thirstlessness. If you look at his tongue is clean. And if you see the rals, they are fine rals. They are not coarse rals, but they are fine rals or rhonchi. That is what is ipecac. And this is what is known as soric stage. Because there are a lot of PQRS symptoms, there is no structural deformity, changes are only functional. As soon as the skin symptoms are established, treatment should be discontinued and patient should be put on placebo. Usually in these cases, no acute treatment will be required. Even the skin symptoms will be cured and no complications or problems will occur. What response should we expect during treatment in psoric phase? Number one, as we have already said, if your simillimum is perfect, if your remedy is perfect, whatever skin symptoms or whatever symptoms were suppressed, they have to reappear. Second thing, the spasms will stop. Third, the patient feels mentally and emotionally better. As we all know, after a particular perfect simillimum, what is felt better is the patient feels better. Maybe his asthma may not be better, but physical generals are better. So patient feels mentally and emotionally better. Response to stimulus feels healthy. There is a feeling of well-being. Patient responses like sleep, appetite, stool, everything becomes normal. The patient is able to face stressful situations in a much better way. In the psychotic stage, changes are relatively more structural than SORA. There are more spasms, less of secretions, and at the same time, edematous condition of the bronchioles persist. The secretion of mucus is very difficult to expectorate. Here we can think of a remedy called causticum, which has got a lot of asthma, a lot of bronchi, a lot of rals, and there is cough, cough, cough. He keeps on coughing, nothing comes up. Whatever comes up, it goes down immediately. So whatever comes up, it is difficult to expectorate. With a lot of coughing, there is very little expectoration. The patient is allergic to many items. Patient feels worse in damp climate and on getting wet. This is what we meant by hydrogenoid constitution. The perfect example is thuja. Perfect example is natrum sulph, Arenia diadema. These are the hydrogenoid remedies. He is perfectly alright as soon as he goes to any dry place. What is the response desired in the treatment in psychotic miasm? First of all, the expectoration becomes easy. The patient is going to tell you, doctor, when I came to you with my asthma, the expectoration was so difficult, I was not able to expectorate, but now after the medicine, I have started expectorating and my asthma is better. So easy expectoration is the best follow-up or the best protocol for a psychotic asthma. Better tolerance to humid atmosphere and rainy season. Any indicated remedy like thuja or natrum sulph, when it is given to the patient, he is better in humid atmosphere, better in rainy season. And even the musculoskeletal involvement like joint pains, lumbago, back pain also reduces. In psychotic, also the skin symptoms may appear. Re-establishment of discharge is there. Patient feels better immediately. He may require constitutional medicine in higher potency for a complete cure. Known allergens do not react much when they are introduced in the system. Like somebody who is allergic to some kind of food or some kind of allergens. Immediately his allergy reduces even if the allergen is around. In short, the resistance of the patient goes up and he is able to fight the disease much better. In tubercular stage, the patient may directly jump from psoric phase to tubercular phase, sometimes skipping even the psychotic phase. This happens when the patient gets any acute viral infection or has a strong past or family history of tuberculosis and a very strong suppressive line of treatment too. Management of tubercular phase is always difficult because the attacks are very erratic. The doctor needs to correctly, carefully select the medicine, potency and repetition. The acute medicine should be given in low or medium potency with minimal repetition, and the intercurrent has to be given in higher potency to prevent recurrence. The response desired in the treatment of tubercular phase, first of all, large amount of expectoration comes out. Difficult to manage and keep patient symptom free, but he may require change of acute medicines in case of superadded infection. If the treatment is right, acute infections and allergic response will come under control. In few cases, you may require intercurrent medicine. The medicines, remember, should be given in medium potency, not in high potency, not in low potency. Lastly, in syphilitic stage, in this condition, lot of structural changes have happened. Lungs are functioning only 20 to 30%. So the line of treatment is usually palliative. So you have to think of acute medicine which has to be given in low potency and frequent repetition. Only when the acute attacks are gone, you can think of a constitutional remedy, but that also cannot be given in a higher potency. You will have to give in 30s or 200s only, because any 1M in case of syphilitic stage can cause prolonged or killer aggravation in a patient of asthma. Response desired to the treatment in syphilitic phase is, first of all, there is decrease in intensity and frequency of the disease. There is better mobility, less breathlessness and complications, and most important, better resistance. The quality of life has to improve. The most important thing after homeopathic medicine is, whether it is a psoric stage, syphilitic stage, psychotic or tubercular, the aim of the homeopathic physician is to increase or improve the quality of the life of the patient. It is not only the subsidence or reduction in the symptoms, but also increasing or improving the quality of life. Now, what are the other management related factors? First of all is the age of patient. Always think that whenever a patient comes to you, the patient is going to ask you, doctor, how much time it will take for me to get cured? Because he has gone through so many doctors, so many inhalations, so many steroids, so many tablets, that he is really fed up of everything. And the patient is going to ask you, doctor, what are you going to do different? How am I going to feel well? The most important thing is look at the age of the patient. If the patient is older the age, it is more difficult to manage. So you have to really remember when you're going to promise the patient, don't over promise the patient. Older the patient, lesser is the resistance, lesser is the susceptibility, and longer will be the duration of the treatment and longer will be the treatment. Ask him, have you taken any previous treatment? If the patient has taken many medicines, it is not possible to manage him immediately. But in a virgin case, It is very, very easily managed without any complications. For the virgin cases, the picture of the patient is original and unmodified. Therefore, Hahnemann also says that when a patient of chronic complaint comes to you, and if you can manage him with placebo for some time, the original unmodified picture of the disease comes up, and then you can think of a similar one. Third is drug or steroid dependency. Patients who have been sick over a long period of time, developing drug dependence to a greater extent to a certain drugs, may require larger quantities of drug over a certain period of time. Now, it's not only the homeopathic treatment that is important, but you also need to tell the patient about the auxiliary measures. You have to talk about simple instructions. Initially, when the patient starts treatment with you, just tell him to avoid the known allergens. If you have a pet at home and if you know that there is an allergy, of course, having a pet at home will give you the symptom that care and love for animals, and you may come to the drug of the patient. But at the same time, you'll have to tell the patient to avoid known allergens. Totally avoid cold drinks, cold water, ice cream, colored food items, etc. Even gluten, even milk items can be avoided. Some people are allergic to them too. Avoid food with preservatives or additives. Take dinner as early as possible. Because many a times a gastroesophageal reflux can also trigger an attack of asthma. What are the homeopathic remedies for asthma and how do we manage? We have already seen, friends, what is asthma, what are the symptoms of asthma, how asthma can be cleaved, or what is the miasmatic cleavage of asthma. Now we all know what is the psoric asthma, what is the psychotic asthma, what is the tubercular asthma, and what is the syphilitic asthma. We also know what are the chances of cure in a patient depending upon his age, depending upon what remedy you are giving, depending upon what treatment he's already been taking, depending on the duration of the asthma. All these factors are very, very important when you are selecting a homeopathic remedy. It's not only the remedy which is selected is important, but it is also the state of the patient which is important, which we have to know. Therefore, a thorough clinical history is very, very important. We'll have to examine the patient. As homeopaths, we rarely examine the patient for rales, bronchi, his breathing capacity. We hardly use anything which will tell us what is the capacity of the lungs. We will have to use modern instruments, friends. When we use modern instruments, we'll know exactly what are the parameters for the cure. After the homeopathic remedy and before the homeopathic remedy, we should have a evidence-based practice, and that's the most important. Giving a remedy and reduction of the attack is not the criteria, but how the attack is reduced, in what way it is reduced, what is the evidence before and after is very, very important. How homeopathy helps? Now everybody knows that homeopathy is very, very good for asthma, but how does it help? First thing, it reduces the frequency of asthma attacks. Second, it reduces the severity of attacks. It enhances the immunity, whereby your tendency to get frequent cough, colds, throat infection reduces. It reduces the need for bronchodilators, cortisone, inhalers, antibiotics. It improves overall health. It is absolutely safe with no side effects. That's the most important thing. Therefore, even in children who are suffering from asthma, you need not give inhalers, you need not give steroid syrups. Think of homeopathy. Children have very, very high susceptibility. Children come up with very, very good PQRS symptoms. If you take the case of a child in a very, very nice way, if you observe what the child is doing during the case taking process, it's very, very easy to treat a child of asthma. Even a simple cough can go into asthma if he just treated with cough syrups or something like that. But if you look at his cough, the way he coughs, the time he coughs, the posture, how he coughs, and if you treat him with homeopathy, there are so many children that we can avoid who will go from cough into asthma into cor pulmonale. So it's very, very important. The commonest remedy which comes to my mind, the first remedy, the prince of remedies for asthma is arsenic album, which covers a majority of cases in acute attack. It has a typical aggravation like everybody knows, 12 to 2 am, 12 to 2 pm, aggravated by cold, better by heat. Arsenic alb is a chilly patient. Now imagine if the patient comes to you with all the symptoms of arsenic, but he is a hot patient. What would you think? You would think of arsenic iode. Arsenic iode is also a very, very important remedy for all kinds of allergies because of iodine. Iodine belongs to the halogen group, and all the halogens are very, very good for all sorts of allergies. So remember, arsenic alb, chilly, arsenic iode, hot. Another remedy is Hiparsulf. Now normally when you think of Hiparsulf, you think of croup because it belongs to the trio of croup of Boniosin, Hipar, Spongia and Drosera, right? But however, Hiparself has a typical modality of bending head backwards. It's very, very important, my friends, to ask these two things to the patient. First thing is, what time is your asthma aggravated? Second thing is, what is the posture that you adopt? Because these two questions can give you the acute totality immediately. A patient of Hiparcel will always tell you that my asthmatic attack or my cough is always better when I put my head backwards like this. So this typical modality of bending head backwards during the acute attack is the Prince modality of Hiparcel. And of course, Hipar is chilly, Hipar has tendency to suppuration, it is hypersensitive, it has got splinter-like pains and sour smelling discharges. All these things constitute Hiparcel. Both arsenic alb and Hiparcel patients have aggravations due to dust. Now dust allergy is so common nowadays with pollution all over in Bombay that half the patients of asthma come to you with dust allergies. And they have always to keep their handkerchief like this when they are traveling on the road. Can they travel with this handkerchief all their life? No. As homeopaths, it is our duty to take away this allergy from them because they are going to live in dust. So we have to take away their allergy. Another important remedy is pothos. Pothos foetidus is an important remedy for dust allergy. But remember the PQRS symptom. The asthmatic symptoms are relieved by passing stools or passing gas, which is peculiar. Once I had a patient of pothos who came to me and he just said that my asthmatic attack is better after I pass gas from my anus. And pothos did wonders. A asthma of 5 years standing just went away. He could just live without his steroids for the rest of his life. Another hot remedy which is similar to arsenic iode is antimony tart. Now antimony tart has to be remembered as a mineral which has to be given later stages. I think before antimony tart I will think of a remedy called ipecac because ipecac belongs to the plant kingdom. So any initial asthma, if it is associated with a lot of nausea and vomiting and it is thirstless, I'll think of ipecac. But ipecac, according to Kent, is for the stage of irritation. Irritation in the lungs is ipecac. But when there is paralysis of the lungs or paralysis of the cilia of the lung, where the mucus which lung tries to put it out in form of expectoration, the cilia don't work. Therefore, the mucus starts accumulating in the lungs. The patient starts drowning in his own fluid, as they say. Therefore, antimony tart has to be considered only after ipecac. The patient who requires antimony tart will have marked flapping of LNSI. Don't forget the other two remedies, lycopodium and bromium for flapping of LNSI. Now there is one more remedy you think of called antimony ars, which is a very very near specific remedy for emphysema and asthma along with emphysema. Lycopodium also has flapping of LNSI, but lycopodium patient will feel better by warm drinks. The sequential relation of lycopodium, calcarea and sulfur is very very important. Baryta carb leads to repeated respiratory tract infections and is as slow acting as calcarea carb. But remember, in calcarea carb there is a generalized delay of all the milestones, while in Baryta carb there is a patchy development of any one of the milestones which are delayed. Soranum is the chili equivalent of sulfur. In Soranum, the patient feels better from lying down, which is peculiar, my friends. You know why? Because most of the asthmatic patients would get aggravated by lying down. They have to actually sit up. But Soranum patient will tell you that, doctor, I feel better only when I lie down and I abduct my arm, just like the Christ. So he's better by lying down and spreading his hands wide apart. Remember, there is yet another remedy which feels better by lying down, but exactly opposite of Soranum. Soranum would feel better by sleeping on his back, but this remedy is better by sleeping on his abdomen and protruding his tongue. Can you tell me what is the name of the remedy? Yes, you're right. It's Medorinum. The remedy is Medorinum. Another remedy which is commonly used is natrum sulph. Now natrum sulph is a remedy for hydrogenoid constitution. It is a brother of thuja. They call it biochemic thuja. But natrum sulph, the aggravation time is very very important. It is 5 am, 4 am, aggravation by damp and better in dry place. In case natrum sulph fails, remember a remedy called magnesium sulph which will act wonders. So don't forget magnesium sulph for asthma, which is not relieved by natrum sulph. There are other antipsychotic remedies like Dulcamara and Restox which are aggravated by damp, the patient is chilly and they are better in dry climate, right? Another remedy is natrum mur where there is a lot of upper respiratory tract allergies, lot of sneezing, but remember the time aggravation 10 to 11 am in natrum mur. Now remember a remedy called cannabis sativa, which we would always think of in acute stages of gonorrhea, right? Cannabis indica, we think of people who are hysterical, people who are always, in the picnic mood, marijuana, right? So cannabis sativa is a remedy that makes the patient stand up entire night. As I told you, these two things are very, very important. One is the thermal modality, one is the postural modality, and second is the time modality, right? So this posture of cannabis indica is very, very specific. They would actually stand the whole day, whole night straight. Because if they sit down, if they lie, their asthma is going to be aggravated. So the asthma makes the patient stand for the entire night with his hands supported on his knees with the past history of gonorrhea. Thuja, again king of remedies for psychotic asthma, aggravation time 3 a.m. 3 p.m. and tea aggravates the Thuja patient. Medorinum, again king of psychotic, hot patient but better by lying on his stomach and protruding his tongue. But don't forget the characteristic of Medorinum, craving for ice, craving for sour fruits, craving for green fruits, which normally a asthmatic patient would be aggravated. Medorinum would desire for sour fruits. Another very important remedy which I feel in practice comes very commonly and can be many times given empirically. Empirically for asthma is Kali Carb. Most of the patients which don't respond to arsenic will respond to Kali Carb somewhere or the other. Kali Carb is a chilly remedy and the aggravation time is very, very specific, around 3 a.m. to 4 a.m. Think of Kali Carb, Kali Ars. Kali group remedies have aggravation between 3 and 5 a.m. Think of Kali Carb. And Kali Carb is always better by rocking. Ask the patient, how do you feel better? And he'll say, always I feel better by rocking to and fro. Kali bichromicum again belong to the Kali kingdom, but don't forget the trio of Kali bichromicum. What is the trio of Kali bichromicum? Stringiness, spottiness and lumpiness. Stringiness, spottiness, lumpiness and yellowness. Yellow stringy discharges, spotty pains. Even in the chest he will say that I have got a pain in one spot. Any patient coming to you with spot pain here or there, fleeting pains going from one place to another, think of Kali bichromicum, think of pulsatilla. Think of lac caninum for fleeting pains. Another remedy which we cannot forget is our remedy for air hunger, and that is Carbo-Veg. Of course, Carbo-Veg is not only for asthma, but Carbo-Veg is also for late stages when the patient is almost in the dying phase, right? But remember, Carbo-Veg is asthma which comes from gastric origin, just like Nux vomica. So whenever he has some uneven meals or uneven timings of meals, he eats something too much heavy, there's indigestion and then the asthma gets aggravated. Think of Carbo-Veg and Nux vomica. When you have to give Nux vomica, don't forget the ineffectual urge for stool. Because if there is no ineffectual urge for stool, you cannot think of Nux vomica. And if there is not of eructations as well as flatulence, don't think of Carbo-Veg, because Carbo-Veg has to have lot of eructations, lot of flatulence. Most important symptom of Carbo-Veg is he wants to be desired fanning. He wants a lot of fan, and that also very near and fast fanning. Unlike our another friend, the Surukuku, the lachesis, where asthma, the patient feels that he wants wind, but air, wind or draft of air coming from long, not from nearby, right? Nux vomica is a chilly patient, so does not like to be fan, wants to be covered in all the stages. That's very, very important. Next important remedy for all kinds of allergies, whether it is allergy to food, allergy to instruments, allergy to ornaments, any allergy, think of Ferrum metallicum. It is a king of allergies, such as all kinds of fruits, vegetables, eggs, seafood, rice. But asthmatic symptoms are better by walking in open air, just like pulsatilla. But pulsatilla is walking slowly, Ferrum metallicum will be walking fast. Another important remedy which I use commonly as intercurrent is bacillinum, which is a good preventive for asthma in children. In tuberculinum, the attacks are erratic, but there is superadded infection also. So finally, my friends, I just want to tell you something, that when a patient of asthma comes to us, it is not only the remedy which is important, but the approach to the remedy is important. First of all, I need to know what is the age of the patient. First of all, I need to know what is the treatment he is undergone. Secondly, I also need to know what treatment he is taking, whether he is on steroid treatment, whether it is a virgin case, whether it is a non-virgin case. I need to find the original unmodified picture of the disease. I have to first find out whether it is what is the acute attack I am dealing with, or is it a chronic episode. Second most important thing is I will look for the postural modality. I will never ever forget to ask my patient tell me in which position do you feel better. And the asthmatic patient has to tell you, doctor, I feel better by putting my head back, bending my head forward, sleeping on the left side, sleeping on the right side, everything. Position, sleeping on the abdomen. Third thing, the most important thing is the timing. Every asthmatic episode is peculiar. Not all asthmas are same. Just like all patients in homeopathy are different, the timings are different. Kali will always give you the timing of 3 to 4 am. Arsenic will always give you 12 to 2. Lycopodium will give you 4 to 8. These timings are very, very important. Associated complaints. Some people might say, along with my asthma, I've got stomach problems, I've got ineffectual urge for stool, I've got irritability, I've got headaches. Look at these associated symptoms. Dr. Bonihausen was the first one who told us that the concomitant symptoms are very, very important. If the patient says that every time I have asthma, I also feel gastric bloating, think of this concomitant and prescribe accordingly. Another important thing is the symptom of cough. Most of the asthmatic patients we get, they also have cough. Cough before the attack, cough after the attack, very, very important. Whether the cough is with any kind of sputum, whether it is a dry cough or whether it is productive. If it is productive, find out what is the color. Whether it is yellowish color, greenish color, whitish color, whether it is sticky, whether it is watery. It's very, very important. Also look at the consistency. With Kalibai, he's going to tell you that when I spit in the basin, even if I throw 10 mugs of water, it is not going to go away. That is what is Kalibai. Look at the color, whether it is yellow, greenish, it also tells you the extent of infection which is going on inside the stomach. That will also tell you what potency to give, what is the susceptibility of the patient, how much is the pace and the depth of the disease. Taste of the sputum in the mouth. Many patients will tell you clearly that whenever I expectorate, I feel sweetish taste, like stannum metallic. Stannum is a remedy where the taste is sweetish metallic. Sometimes the taste is sour, sometimes the taste is spicy. These are the tastes. Along with the cough, along with the expectoration, whether there is a pain in the chest. Does the patient have to hold his chest? Like natrum self. Natrum self patient is going to say that whenever I am breathless, whenever I am coughing, I have to hold my chest like this. Bryonia also has to hold his chest because every slightest movement aggravates the patient. And last but not least, don't forget the moon phases. Many asthmatic attacks are aggravated in full moon, new moon. Don't forget calcarea carb, alumina drugs. These are the drugs which could be aggravated in full moon, new moon phases. There has been a lot of research conducted for asthma, and we all know that asthma homeopathy is very, very good. In a research conducted by professor at University of Glasgow, Europe's largest medical school, double-blind placebo-controlled trials showed that 80% patients, when they were given a homeopathic remedy, showed improvement, while only 38% patients given a placebo experienced a similar degree of relief. Now I would like to talk about a remedy which is uh, quite well known in homeopathy but does not have its, is not so much renowned for asthma. And can you name the remedy? And it is Ipecac. As regards the remedy usefulness in asthma, there are so many pioneers of homeopathy who have praised Ipecac like anything, and I want you to understand why our pioneers, why our masters have praised Ipecac so much. Dr. Jar, if you know, says that I always commence the treatment of asthma with Ipecac. Now, can you imagine the master saying that I always commence the treatment of asthma with Ipecac? Dr. Roger Schmidt said, I would say that 8 to 9 times out of 10, Ipecac has been only remedy that has given me good results in asthma in children. Can you imagine this? Did you ever think that Ipecac could be the most important remedy for asthma? Because we always think of arsenic, we always think of Kalika, we always think of Medorrhinum. Do we think of Ipecac? Think of Ipecac also. Dr. Hughes, one who has written the pharmacodynamics of homeopathy. If no exciting causes of acute asthma can be traced, Ipecac should be administered when bronchial symptoms coexist. Dr. Laurie says for bronchial asthma during the paroxysms, Ipecac is one of the most frequently used remedies. Dr. Nicole says Ipecac is one of the first remedies of which we think in an attack of asthma and it is worthy of the place it holds. Dr. Frank Boardman states, I will begin the treatment with Ipecac, which I use most frequently in my practice. Dr. Herring states that his Ipecac subjects were fat children with pale skin and other ailments who were worse from anger, vexation and indignation. The trigger factors which start asthma is anger, vexation, indignation. Can we hear some more other remedies? Yes, Staphysagrea and Colocin. Anger, vexation and indignation. Asthma from anger, asthma from vexation. Don't forget chamomilla. Patient gets angry and starts getting asthmatic attacks. First remedy to be thought of could be chamomilla. Also don't forget Nux vomica in anger. Dr. Nash in his leaders states that Ipecac is the best remedy in the first stage of asthma before much mucus is present. He points out that the typical nausea is present even after the patient has vomited and the tongue is clean. Dr. Clark in his dictionary states at length about clinical details in Ipecac cases. He also agrees about patient's irritability and moroseness. Dr. Russell states that Nux vomica should not be forgotten for asthma brought on by indigestion and indiscretion in food. So next time a patient comes to you with asthma with some indigestion or indiscretion food, just don't think of Nux vomica. Think of Ipecac also. Another very important remedy is Thuja. According to our own Dr. Wadia, a famous homeopathic physician no more, he has found Thuja one of the most important remedies to be taken into consideration, which I have also seen in my practice. Most of his patients who came to him for the first time have lot of vaccinations and inoculations. Not only that, but they also have dreams of falling from great heights, missing a step and falling down, dreams of dead people, dreams of anxiety and misfortune. This is a great remedy for hydrogenoid constitutions because their asthmatic episodes are always aggravated in monsoon. And this is also very helpful also to patients who drink a lot of tea. Dr. Borland states that if I have no other lead, I should probably start my cases on Thuja. There is yet another remedy that I'll bring to your notice, and that is Cuprum metallicum, which I have used a lot in young children, small children with asthma. And the peculiarity of Cuprum metallicum is the timing again. The timing is at around 3 a.m. The cough is with sputum and the cough is better by sips of cold water. So it should be given when the asthmatic fit is very intense. Now remember, Cuprum means camp. Cuprum means spasm. There's a lot of spasms. Cuprum is an important remedy for epileptic fit. Everybody knows that. But Cuprum is also an important remedy for cough. Cough with spasms accompanied by cyanosis during and after the attack. The cough and suffocation are better after drinking some water, and the time of attack is 3 a.m. So don't forget the time. That's very, very important. Cuprum metallicum. The remedies like Senega, Kali bichromicum, arsenic iode, Blata orientalis. Don't forget our cockroach, the American cockroach, the Indian cockroach, Blata orientalis, which is a very, very good mother tincture for asthma. For acute attacks of asthma, even if you are using a nebulizer and if you put a dilute solution of Blata orientalis mother tincture and let the patient breathe, the acute attack many a times goes away. In treatment of asthma, miasmatic classification is very, very important, especially for potency selection, repetition, prognosis, evaluation of the effect of medicine and total patient management. Secondly, observing ancillary measures like diet, lifestyle changes and removal of maintaining causes are very, very important in treatment of asthma. In an acute attack, making an acute totality with the help of ailments from position during the attack, the time modality along with other modalities is very, very important. While in chronic cases, a full detailed case including the miasmatic cleavage and the lifestyle of the patient is needed, and many a times an intercurrent is required with a constitution to remove the miasmatic block. As we were talking of psoric asthma, we see that most of the cases coming to us are with psoric miasm and the psoric asthma. And whenever it is involved with any kind of allergy, if it is an allergic asthma, it is usually psoric miasm. One of the most important characteristics of psora is the inheritance of a tendency to develop certain diseases. And I need hardly remind you of a strong family history of one or more triad of asthma, eczema and hay fever. This is the first important approach, and homeopaths will frequently use remedies which are classed as antisoric, notably soranum, sulfur, other important antisoric medicines like lycopodium, calcarea carp, silicea, natramine and arsenic. It is also held that the use of constitutional remedies can improve allergic illness. The subject of constitutional remedies is the most important, at the same time the most difficult to any novice in homeopathy. Thirdly, it is possible to desensitize patients to know the allergens using homeopathic doses of allergens, which is known as tautopathy. The obvious examples are house dust mite, grass pollens, animal dander, molds and so on. Homeopathic preparations can be made of any allergen, and acute reactions to their administrations have been never recorded. These three approaches to homeopathic treatment are common to the triad of atopic illness, but one or more of these approaches may be considered in any particular case, and desensitization can even have a dramatic effect on its own. So my approach to the treatment of asthma would be, first of all, the homeopathic treatment of asthma, prevention of attacks. Look at the components, whether it is an allergy, whether it is an infection or whether it is stress. Similar approach, antisoric remedies as to allergies in general, constitutional remedies, desensitization using suspected allergens. Second, use of nosodes in order to prevent the recurrence, prevent infection and treatment of infection. Third, and the most important, is psychotherapy and psychotherapeutic use of constitutional remedy. Treatment of attacks, the choice of the remedy is based on the exact symptoms. As I have told you, ask the ailments from, look at the typical modalities, the postural modalities, the time modalities and the other modalities. You will see that both prevention and treatment of attacks is considered. The components have been listed to show the approach to the treatment of each. The general approach considers antisoric remedies, constitutional remedies and homeopathic desensitization. But when we come to asthma, which may follow prior infection with respiratory viruses and so on, homeopathy is able to provide a group of remedies which is known as nosodes. Nosodes are our last ditch stand. Don't misuse, don't abuse nosodes. Keep nosodes for the last attack. Remember that. These are the potencies of material from infections, disease containing organisms, and they are the ones that can prevent episodes of infection or even for clearing any kind of infection. So let us talk about what we did today, friends. Today we talked of bronchial asthma, which is so very important in homeopathy. Not even a single patient of asthma should go away uncured by homeopathy. This is the most important take home message today. Every patient of asthma, every patient of skin has to be with the homeopath, has to be cured by homeopathy. Any patient going from homeopathy to allopathy of asthma or skin is a big sin, and it's a big slap on our face, because homeopathy is the only treatment for such kinds of illness, and we have to treat them with homeopathy. In the treatment of asthma, first of all, find out the miasm. Look at the miasmatic classification. Once you know what kind of asthma it is, whether it is psoric asthma, psychotic asthma, tubercular asthma or syphilitic asthma. Once you know what kind of asthma it is, then find out what remedy comes very close to. Once you know the remedy, you know the depth and the pace of the remedy. Match the remedy with the miasm. Don't give belladonna, don't give aconite in a syphilitic kind of asthma. You have to know the depth and action of the remedy. Once you know the remedy, look at the potency. Now, don't give a low potency where a high potency is required, because then there won't be any effect. The patient will be disgruntled. He will be unhappy. He won't. Actually, the patients coming to us are so frustrated that they are just on the verge of going away from you when they come to you. So you have to hold them. So it's very important to select the right potency, repetition, and tell the prognosis to the patient. Homeopathy has to be predictive. Homeopathy is mathematics. You will have to tell the patient what is going to happen after he takes the remedy. Because when it is so easy, if you tell him and he gets the desired result, his faith in homeopathy is going to increase. And when his faith is going to increase, he is going to take the medicines regularly and he will develop faith in homeopathy. Evaluation of the effect of the medicine and total patient management is important. As I have told you, it's not only the homeopathic drug but also the diet and the lifestyle changes. Removal of the maintaining causes, especially in allergic patients who have pets at home, patients who have not cleaned their home, they need to vacuum their home, patients who are living near forest areas where there is a lot of pollen. These things have to be prevented for some time, at least till the constitution is going on. Lastly, in an acute attack, make an acute totality. Don't think of the chronic remedy. Think of the chronic remedy once the acute attack subsides. But in an acute attack, look at what are the ailments from, look at what is the position during the attack, look at the time modality along with other modalities. While in a chronic case, once the acute attack goes away, then take his detailed case, including the miasmatic cleavage, lifestyle of the patient, his stressors, how is his reaction to stressors, and many a times an intercurrent might be required with a constitution to remove the miasmatic block. So today we have discussed about asthma and its homeopathic management. We have discussed about how to make an acute totality, how to make a chronic totality, what are the types of asthma, what are the different managements of different asthmas, what are the homeopathic therapeutics, how positional or postural modality is so important, how time modality is so important, and we have seen so many examples. I hope that after this webinar, the treatment of asthma or our patients who have got asthma, I am sure that it will help you and you will be able to use whatever I have talked today. These are not only my experiences but experiences of my teachers, experiences of my masters. Use all these experiences and see to it that no patient of asthma has to go away from you. He has to be your patient and he has to remain your patient. Okay? Thank you very much. Bye-bye.